Hey you guys, my name is Christine and welcome to my YouTube channel. In case you have not heard, the healthcare system in the United States is less than ideal. There are a lot of issues that we have going on here that I'm not sure they're ever going to be fixed. It's a little complex and a little complicated. But anyways, in today's video, I'm going to talk about some decisions, practices, things that Americans do in regards to healthcare that just doesn't make sense to people from other countries and the rest of the world because they don't have a system like ours. All right, first things is something I was thinking about the other day. As we are approaching the end of the year, people try to maximize their prescriptions, procedures, get everything done before the year is over because as of January 1st, everything resets for healthcare. If you have a deductible, you're now at a new deductible, you're at a new max amount of pocket, everything resets at the start of the year, or you just might not have the same coverage or as good of coverage or any coverage come January 1st. So I know for me on a personal basis, since about August, I have been refilling all my prescriptions as soon as I am able to refill them each month, even though I'm not necessarily out of medicine yet. I know that my current insurance is going to cover the prescriptions. I'm no longer having to pay a copay for these prescriptions, and I'd rather have a stockpile to bring me into next year because I'm really not sure what my health insurance next year is going to be like, what it's going to cover, if it's going to be covered. So I'd rather fill these things while I can and not have to pay anything for them. I've also made sure that I have made my doctor's appointments that I would like to make sure that I can see before the year is over, and I know these doctors are covered, and I just don't know what next year is going to bring. I mentioned this in another video, and it was something that surprised me, mainly because I just never thought of it. The fact that people, when they are planning on getting pregnant, actually try to shoot to make sure their whole pregnancy is in one calendar year, so they only have to pay 1 year's worth of deductibles and costs and fees, whereas if you were pregnant and you were due in February, you got to pay a whole lot for 1 year, but then in January and February, you got to start over at a new deductible and max amount of pocket and whatever. And yeah, makes sense that people do that. Is something I never thought of because I've never planned on having a baby. And I think it's sad that it's something that people have to do here. The second thing is the fact that we have to find out if our ambulance, our physician, our hospital is in network or out of network. I'm sure most people have heard these horror stories of people who go in an ambulance and then get like a $5,000, $7,000, $8,000 bill for this ambulance ride. There have also been more recent stories with physicians coming into hospitals who the hospital is in your network, but the physician is out of network. So examples of this are if you had surgery or you had a baby and you thought everything was covered, you looked into it, the hospital was in network, the physician doing the surgery or delivering the baby was in network, but then the anesthesiologist, who you have zero control over, comes in and they are out of network, and now you're suddenly slapped with their bill because your insurance doesn't cover that anesthesiologist who you had no control over, who came into your room and administered this medication. That is ridiculous. In relation to this topic, also with hospitals, if you have an emergency, sometimes you're left questioning, is the nearest hospital in my insurance company's network? Sometimes insurance companies will cover out-of-network hospitals in cases of emergencies, but you might not know that, and when you're in the middle of an emergency, you might not have the time to check your insurance policy, and you might be at the thought process of like, should I get this checked out or risk dying? Or I don't want to be slapped with a $50,000 bill because I went to the wrong hospital. And And then on to the ambulances. About 5 years ago, I was at an urgent care facility, and the urgent care facility had recommended to transfer me to the emergency room. I had heard all of these horror stories about ambulances and the cost of ambulances. Now, I was told I had to take an ambulance from the urgent care to the emergency room. I was like begging the doctor to let me just drive there. And he said I would be leaving against medical advice, which would then mean my insurance would deny my visit to the urgent care. I don't know if that's true or not. And because of liability reasons, they had to send me in an ambulance. Anyways, here I was, close to midnight. I was calling my insurance company and asking them, like, hi, is this ambulance ride going to be covered? Am I going to be slapped with a huge bill? The only person at the insurance company in the middle of the night was the on-call nurse, and all she told me was to follow medical advice and follow up with them in the morning. So everything ended up being okay. I followed up with the insurance company in the morning, and I was told, yeah, your ambulance was out of network. Crap. So I asked them, I was like, out of curiosity, in case I ever get into a car accident or anything, what ambulance is in network? And I was told there are no ambulances in your area that are in network of this insurance company. It's like, wow, that's awesome. Now, at the end of the day, I never did get a bill for this ambulance ride. This was over 5 years ago, so hopefully some bill doesn't come in the mail in the future. I'm hoping it is in the past, but I think it was covered ultimately. I don't know, but I have heard of Americans abroad that when something happens and people try to call an ambulance, they're like, no, don't call an ambulance. I don't want to pay for it. And people are like, what are you talking about? You're not going to have to pay for this ambulance ride. And I think it's very, very sad that in this country, we ultimately are so scared of just going bankrupt because of an accident or something happening that we don't really go like a proper route because nothing is covered. I don't know how to phrase this better, but anyways, let me just get on to the next point. The next thing is something that I have seen for a very long time, and it is that doctors will write a higher dose prescription so that you can get 2 months worth of medication for the cost of one copay. This is a practice that has been going on since I was in high school. And for reference, I'm 30 years old, so it's been a little while since I've been in high school. But say you're take any medication, say you only need to take it once a day, the doctor will write a prescription for twice a day, but tell you verbally, take this once a day, it'll last you for 2 months, and that way you only have to pay 1 month's copay for picking up the medication. And this is something that I feel like everybody knows happens, but we all just pretend like it doesn't happen. Like it's not technically lying. It's just like an accepted practice that we have to do because our healthcare system is just not up to standards. Like I don't know how to word this better, and it's really thoughtful that doctors do this to help patients out financially. What I think is sad is the fact that they do have to do this and they do have to practice medicine in this way. Whereas if we live somewhere where healthcare was more affordable and covered, they wouldn't have to necessarily practice in this way. The next thing is when you are at a doctor's appointment and simply asking if a procedure is covered. I've become very paranoid about this, about myself. Whenever I go to a doctor and they're trying to do some like random test on me at the doctor's office, I will point blank ask, is this covered on my insurance, or am I going to get a separate bill for this? And oftentimes the doctor doesn't really know, and you can't blame them on that. They don't know every insurance company out there and what's going to be covered and what's going to be denied and what's going to fall back onto the patient. And you're hopeful that whatever test or procedure or whatever they're trying to order is to help you or to be used in a diagnostic purpose or a medicinal purpose. and not just to crank up money for their facility and increase their revenue, because I'm not blind to that happening as well. Trust me, I know that happens. But it is really sad that as a patient, your first thought process is always, am I going to get a huge bill in the mail because I'm doing this thing that the doctor's recommending for me to do? And so, like, for me, my immunologist currently is out of my insurance network, and he'll sometimes recommend for things to be done during my appointment, but because he's out of network, when these things get done, they're also out of network, so they don't get covered. And so many times I'm like, can you just write me a prescription so I can go get this done somewhere else where it will be covered? And he's always telling me like, oh, you won't be billed for it. But I unfortunately have had to pay the out-of-pocket costs so many times on these tests. I don't let him do anything anymore other than just the standard doctor visit. I get I have to pay that out of network and out of pocket and whatever, but it really stinks when you get like another $500 bill slapped on because he insisted on something being done in his office that could have been done at another facility and would have been covered in full. So, you know, I'm just saying. And the last thing, and probably the most important, is simply the fact that in this country, people put off seeing a doctor, going to an emergency room, getting procedures, getting medically necessary done procedures, getting tests, getting treatment, getting just anything, because it just costs too much money. And even me, I've not sought out medical care because I don't know how much it's going to cost. I don't want to risk having to pay a lot of money just to find out or to hear a doctor say like everything's okay. You know, that's great news to hear that, and you're super happy that's ultimately what they're saying, unless there is actually something wrong and they just haven't figured it out. But you don't necessarily always want to risk having to pay a whole lot of money and maybe nothing was wrong. And so it's a shame because I know me as a physical therapist, I have seen patients who ultimately have had really bad strokes who would have not had as bad of outcomes if they went to an emergency room sooner. But sometimes people question the symptoms that they're feeling or the signs that they're seeing and thinking maybe they'll just go away. And things like a stroke, you really need to get to an emergency room ASAP to get the best possible outcome in your situation. It's really a shame, the fact that so many people put off medical care just simply because they cannot afford it, and there's a lot of negative outcomes and negative results and unnecessary deaths because of this. But that's just the country that we live in. I wish I ultimately had any ideas of a possible solution to fixing this. Universal healthcare, I think, would be a wonderful thing, would be a great idea. I personally don't think we are going to be seeing it in the near future because of just the practicality of implementing it and how much it would change in this country. And I really want to make a video on this alone, but I want to do some more research to support my opinions. So yeah, that's going to be another video. But anyways, that is it for this video. I'm done ranting. I sometimes wish I lived somewhere else. But what can I do? This is where I live, this is my home, and it's just what I gotta deal with, unfortunately. And I do hope one day things will change. Let's cross our fingers. And if I am wrong at any point of this video, or if you live in another country other than the United States and you deal with some of these things, please let me know. I'd love to open my mind and expand what I do know, because I don't know everything. But that is it. I hope you enjoyed this video and the rest of your day. Adios, muchachos. Bye!